like to move to a very key question that we have to ask ourselves about the use of MRI in the post-COVID period, and especially what kind of imaging protocol we can put together. Is there a place, as Joseph you show, for total body imaging with MRI, or is it too long to perform on a patient, or can we use minimal acquisition for each of the organ, and what are the organs that should be targeted, and which patients? And this is a very important question I'm asking always myself. And I already asked you the question, severe ones that now are out of the hospital, or mild to moderate one, because we want to screen them to make sure that they don't have a cardiac scare, that they don't have a pulmonary involvement, that they don't have sequela of the or in the brain or in the kidney. So I leave this question open. So please give the advice and ask a question if you wish to the other one. So please go on. I don't know who wants to speak first.
Okay. I can begin. One of the problems we are having is to select controls for comparing patients who were exposed to COVID, and being able to be sure that the alterations we are seeing were induced by COVID. And I think Vincent showed in a marvelous way how this is also going to be a challenge in the might be a challenge in the brains as well. So for those, I would like to ask Dr. Puig, Professor Puig, what do you think the value? Because we think that perhaps these databases of normal individuals, or individuals that were healthy in the community, will be very helpful for comparing with individuals that were involved by COVID. What are your thoughts about that?
Yes, this is a very, very, very interesting, and we have to solve, if we want to perform one promising study in this issue. This is a critical methodological point of view, Professor Lima. I personally agree that we have to go for the normal cohort of participants, no patients, of participants. Yeah. We have to go before the pandemic. We have to go for this kind of data sets, Asian Imagenomics Study, UK Biobank, German cohorts. We have to go for the period of before the pandemic, because if not, the confusional factors that we will have in the statistical analysis will be crazy. Because really, we don't know if the population is or not infected at this moment. And what about the tools to measure this immunity? When you have one patient target with the level of infected, you can have the confirmation of this case. But to put another case, if we plan case control, if you put this control without this kind of lab tools, probably we will have serious critical methodological problems. We have to study for the controls. We have to study people examined before the pandemic. This is my feeling. But another issue is the protocol. Merge the protocol. Now, if we develop one interesting protocol, probably less than 1 hour examination. No, less than 1 hour, because we can study the whole body, but for the COVID,
1 hour is a limit.
1 hour is the limit. Completely agree, fully agree. But now we have to administrate contrast, mainly for the vascular and for the health, to evaluate the cardiac morphology and the cardiac function. But in this kind of normal cohorts that we have at this moment, when we try to study the whole body MRI in a population-based study, we do not administrate contrast. So this will be one limitation. But my feeling is I prefer to have this retrospective recruited cohort than to study one theoretically normal patient, non-COVID. Because if not, when we submit this kind of study to a top-level journal, methods always, or 80% of the rejections are due to problems in methodology, and this could be a serious problem. Yeah, and about the protocol that you, Professor Doucet, present, I think this protocol covered the main areas in the brain, but probably, if could be possible, I would like to introduce one resting state examination, mainly to compare the evolution, the follow-up, because probably this kind of virus affect the whole brain, probably. So we can see some alterations in some targets, the nuclei, in the basal ganglia, the cortex, but probably if we consider independently the viral invasion or one more autoimmunitary reaction, probably in both the scenarios, the brain is affected as a whole. So the alteration of functional networks correlating with cognitive function after the COVID, in a similar way, is completely different, but in a similar way, like the mild brain trauma injury. You don't see nothing, or a slight imaging, slight findings in imaging in the baseline, but the 10 or 20% of the people have some kind of disturbance several months after the initial injury. So probably here in the COVID, this could be one possible scenario. And my feeling is that functional networks could be help us to study this kind of affection if we consider the brain as one entire organ.
My conclusion is an open conclusion, because
Yes.
I think that based on what we said, it seemed that it would be interesting to set up a protocol, first a protocol with a rationale behind each of the sequences. We heard, for an example, that gadolinium was probably compulsory for the heart, maybe interesting also for the brain anyway. So we also understood that maybe brain and heart and vascular bed are the first target. Maybe try to do a protocol that is below 1 hour, and also discuss between us, maybe other teams, so according to what Canon wants, but maybe try to see what is the rationale for scanning and which patients should be scanned, should be followed. Either those are mild, moderate, severe people, patients that, I don't know. So maybe we have to discuss that and go fast, because there are also competitors. We are not the only one thinking about looking at the brain and the heart of COVID patients. So I propose that in the next days, to go fast, we really discuss through the email and other means to have a protocol of research for with the Canon technology.
Yes.
Is that okay?
That would be fantastic. Yeah.
Yes, that's great.
Okay. So any word of conclusion, each of you? Is that
I think you perfectly conclude all the scenario, Professor Doucet. Excellent moderator.
Thank you very much, Joseph. Luca, any word?
Thank you. It was a great discussion, and I'm very happy to be here and looking forward to see the outcome of our discussion with the protocols and cooperation among Canon. Thank you.
Great.
Thanks a lot.
Thank you. João, the last words for João.
I would like to say thank you, Vincent. You did a fantastic job and summarized it quite well. And I'm very interested in remaining very engaged with this group and defining what we are going to be doing next. Thank you.